incidentally, we also completed our 300 liver transplants, as Mr. Chandrasekhar Garu informed you. And again, this is a good achievement for us, but more important is the fact that you just don't transplant them, but you also care for these patients so that they lead very productive lives. They join the mainstream of the society and they are as normal as you and me are. And that is something that this program is really proud of, because I think this is the only program in the country where we have a follow-up of 10 years plus on patients who have received a transplant. So as you all know, transplantation activity in this country has been going on since the latter half of 1990s, but sustained programs started only in this century. And our program started in the February of 2003. After some time, you will get to interact with somebody whom we transplanted almost 10 years ago, and she would be able to share her experience. Of course, at that time, transplant, quote unquote, was still considered experimental, but you can see the results of that experiment today. Now, not talking about the transplant and talking about the World Liver Day as such, it is very important to note that in our country, we do not have a registry or a database to tell us what is the prevalence of serious liver diseases. So when we talk of liver transplant, we know that liver transplant happens primarily for three conditions. Most commonly is people who have got advanced liver disease or cirrhosis. Second is when people have got acute liver failure. That means they were normal, but acutely the liver fails and it does not respond to medical treatment. And third is certain patients who have got liver cancer, for whom the best treatment is liver transplantation. So I will dwell only on some aspects of chronic liver disease, because as a physician, that is something that we must address. The important thing to remember is that oftentimes we are only concerned about the treatment aspects. So there are many things which can be prevented. So I think in our interaction with the media a few months ago, we had dwelled on certain points. The two important things that we must realize are that there are some infections which can be prevented through vaccination, and there are some liver diseases which can be prevented through healthy lifestyle. So hepatitis B is one such example. You know that this is the commonest cause of chronic liver disease in this country still, even though the vaccine has been available for more than 3.5 decades. The vaccine is dirt cheap. It just costs about 30 to 35 rupees for a dose. But still we do not have it in our universal immunization program. So that just reflects the apathy of the administration and the government in particular regarding this very important health related issue. So you take the shots, and there are certain countries in the world which had a much higher prevalence of hepatitis B than even India, but now they are almost free of this infection. So this is a preventable infection, preventable disease. Hepatitis C, unfortunately, our efforts in the lab have not yielded any success, and the vaccine is still not available for this important virus. This is one of the commonest viruses which produces cirrhosis in the Western world. In our country, it is the second commonest infection which infects the liver and produces cirrhosis. But again, the community prevalence in different parts of the country is anywhere between 2.5 to 4%. And for hepatitis B, in most of the parts of the country, it is about 2.5%, except the northeast, where it can be in double digits also. The disorders of lifestyle. Most important is fatty liver disease. Again, many of us and many of you in the audience also would have realized that there is some family member who goes and gets an executive health checkup done. The sonologist tells them that there is fatty liver, and they will just throw that report in the bin, saying that every other person has got fatty liver. So what's the big deal about it? But fatty liver is now emerging to be the commonest cause of chronic liver disease worldwide. So this is something that is a clear danger for all of us. We very often ape the West. So just to give you a perspective, in the United States, which has got population roughly half the population of India, about 25% to 30% of people have a BMI of more than 25, which tells you that either they are overweight or they are obese. And about 8 to 10% have got established fatty liver disease. When I say it is established fatty liver disease, I mean that it is not just the fat which is infiltrating the liver, but it has also produced its sequelae. So when you get liver infiltration by fat, it can either only be fat or it can be associated with some inflammation, and then in the third stage it is associated with scarring, And finally, the common pathway is that it leads to cirrhosis. So this is now emerging to be the commonest cause of chronic liver disease in the developed world. And this is something that we should be aware of. We all know that we are the diabetes epicenter of the world. Diabetes is one of the predispositions for fatty liver disease, but there are others too. So genetics we cannot alter, but lifestyle we can. And that is something that through your expression we would like the community to know. So through the print and electronic media, I think this is something that we should talk about all the time, because this is a preventable liver disease. And in the initial stages, you just need, very important that the lifestyle changes are instituted early. The second preventable disease that comes to mind, liver disease that comes to mind, is alcohol-related injury. So alcohol-related injury is still a very common problem in our part of the world. In the Western world, the transplants due to end-stage alcoholic liver disease are coming down. At least in our program, we are still transplanting about a quarter of our patients for end-stage liver disease due to alcohol. So I'm sure all of you know that after smoking and hypertension, alcohol is the third most common killer of human race. So smoking is the commonest, followed by hypertension, and alcohol ranks number 3 country. But the Western world has shown that almost 3% in ladies and 8% in men deaths are accounted for by alcohol. So it is not necessary that all of these people are dying because of liver disease, but you know that alcohol leads to a number of other problems. So you can have seizures, you can have withdrawal, you can have rash driving, negligence on the roads, so driving under influence, all these things. And this is a very high proportion that is dying because of hazardous consumption of alcohol. Then there is a term that we use in our medical parlance which is called DALY. So that is called disability associated life years. And again, alcohol ranks at the top in DALYs. It's even more potent than smoking. And in the Western world, about 8% of DALYs are due to alcohol. So this again remains a very big challenge for us. In our country, the patients not just consume the foreign made liquor, but also the country made liquor. And at times it had got certain things added on to the liquor, which can also be toxic to the kidneys, to the bone marrow, and not just the liver. So again, this is something that is preventable. And I think the message should go out to the community that whenever you have an issue with this, it should be addressed head on. There are certain stigma which are associated with alcohol consumption. The families try to hide this problem, and most of the times when this problem has gone out of control, the medical community gets to know about it. So there are self-help groups, there are rehab groups which address this problem, groups like Alcohol Anonymous, and you should not be scared or ashamed of getting in touch with a clinical psychologist if you have a problem with addiction. All of us know that alcohol is not just a physical illness, it's also a mental illness, and these issues need to be addressed. We are seeing only the tip of the iceberg. We are seeing those patients who are very unwell, who are very sick, who need to report to the hospital, and many a times in whom the medical therapy has failed. So they would have tried a host of different treatments, they would have gone to a number of hospitals, not had any success there, and then they land up with the transplant physicians and transplant surgery. But there is a lot that can be done even before that stage, and that is something that we should try to convey to the community. With these few words, I would hand over the microphone to my colleague Dr. Tom Cherian, and we'll be very happy to take your questions at the end.